They don't just live among us, they also live in and on us. The human body is colonized by countless bacteria. These bacteria are harmless and even necessary in many cases. But if they get into our bloodstream or urinary tracts, a number of these bacteria can cause infections. Some of these bacteria are resistant to several antibiotic groups. Such bacteria are called multidrug-resistant organisms, or MDRO. An infection caused by resistant bacteria is more difficult to treat than one with sensitive bacteria that respond well to many groups of antibiotics. Immunocompromised and older patients are particularly vulnerable to such infections. To prevent serious cases from occurring, hygienic measures help block the transmission route of the pathogens. The clinically relevant pathogens are primarily VRE, MRSA, and MDRGN. VRE stands for vancomycin-resistant enterococci. These gram-positive bacteria are found in the gastrointestinal tract. MRSA stands for gram-positive methicillin-resistant Staphylococcus aureus, that is primarily found in the nose and on the skin. Like VRE, multidrug-resistant gram-negative bacteria, or MDRGN, are fond of the gastrointestinal tract. They are resistant to up to 4 antibiotic groups. An infection with any of these multidrug-resistant organisms should be avoided at all costs. The best way to counter these bacteria is basic hygiene in healthcare facilities. Basic hygiene includes hand disinfection. The comprehensive effect of alcohol helps fight sensitive and resistant bacteria. If a patient has been colonized by MRSA, hand disinfection is one way to prevent the patient from becoming infected and from transmitting the pathogen to others. 2 other important steps are surface disinfection and the correct reprocessing of medical products. As bacteria can survive on surfaces from days to up to weeks at a time, these areas pose a transmission risk. In particular, surfaces that are near patients and are frequently touched must be regularly disinfected. Basic hygiene also includes special-purpose personal protective equipment. Other steps should be taken depending on the particular situation. If a patient has a positive screening result, isolation and decolonization may be considered. No matter whether VRE, MRSA, MDRGN, or other pathogens are involved, basic hygiene minimizes transmission and infections. If potential transmission routes are systematically eliminated, bacteria will remain where they should be.